You're still tuned into the South African Morning, and the South African Medical Association is calling for immediate COVID-19 booster shots for healthcare workers and doctors. With a fourth wave of infections expected, SAMA says it's crucial to have preventative measures put in place. The association says that the immunity provided by the single-dose vaccines lasts for only so long. The Johnson & Johnson vaccine given to health workers is one such jab. For more on this, we're joined by Dr Angelique Coetzee, SAMA's National Chairperson. Dr Coetzee, many thanks for your time this morning. I've mentioned briefly in the intro that the booster shots are going to be very critical as we approach the fourth wave. Healthcare workers, which are frontline workers, are going to need to have as much protection as possible when those hospital admissions start happening towards the end of the year.
Good morning, and yes, you are correct. Someone noticed that during the third wave already there was weaning down from protection by the Johnson & Johnson, and it is expected. It was being said, if you go and look at the previous or earlier data, it was predicted that most of the vaccines will last between 6 to 8 months. Also, natural immunity is not going to last forever. New studies going out there is saying that even your natural immunity within 18 months will be 50% less. So we noticed that a lot of our healthcare workers got sick during the third wave. We cannot afford that. We all know and anticipate that there will come a fourth wave. It is a question of when. But seeing that most of the healthcare workers received their first shots around about February, March this year, it is time now for them to get their booster shots. And the data is actually very clear out there. Yes, although you can get a second dosage of the same vaccine as a booster, and it will give you very nice combination, a very nice immune response, but also the data is currently on combining your vaccines. Let's say, and the studies was done especially around AstraZeneca, and then getting a second dosage of Pfizer. It shows that the immunity, the protection was much higher. You've got a much more stronger neutralizing activity, regardless of which SARS-CoV-2 variant is out there. And therefore, SAMA is asking and saying, please, can we start getting our healthcare workers vaccinated? And then again, please let them also then decide whether they want the second booster as being Johnson & Johnson or Pfizer. And then I think it's important for them to have a choice, especially going forward. And with all these data around combining vaccination, right, that is very suitable.
Yeah. Doc, another important element here, I suppose, would be protecting everybody from transmissions happening in health facilities. I mean, talk us through the prevalence of that and really how these booster shots will reduce this significantly, if not eliminate it completely.
So, yeah, it's difficult to say that the booster shots will eliminate your risk to get COVID-19. So we know that at this stage, that if you have these booster shots, especially the heterologous ones, that you display a much stronger neutralizing activity, again, regardless of which variant you're getting. But this is especially important around severe disease. The hospitals barely didn't make it during the third wave because of the overwhelming patients admitted for COVID-19 severe diseases. The problem then is if your healthcare workers also get COVID-19, whether it's severe or mild, they need to also get sick leave, stay at home for at least 10 days, and we cannot afford getting our healthcare workers stay at home. We have a scarce health workforce. and we need to protect them as much as possible. We also saw that the PTSD incidence around healthcare workers is between 35 and 49%. So it means that if in a fourth wave, you as a doctor get COVID-19 because you didn't get a booster shot, that will be adding to your own personal PTSD, because you will feel you're not protected and no one cares about you. As well as if you see patients coming in who've never been vaccinated, and you know that if they had been vaccinated, the load on the hospital and especially in ICU would have been less. That's again when PTSD kicks in, and we are talking about fatigue, the emotional fatigue that the doctors are starting, and the nurses. If I say doctors, I include all healthcare workers, starting to experience around COVID-19. And again, it's again December. We know there is a Delta variant that mutated, and it's something that we are looking and keep an eye on. It's of concern to us. We know there's going to be travel going around December, people going to other countries, coming back. We don't know. So we need to vaccinate our healthcare workers with a second dose. The healthcare workers need to decide for themselves whether they want to have a Johnson & Johnson or a Pfizer. It should be up to them.
Right, Dr. Angelique Coetzee, they're bringing us insights on why it's so important for people, or healthcare workers rather, to get booster shots. And her last point, they're very important, especially with new variants like Delta. Increasing immunity is going to be very important. And she's from the South African Medical Association.